how many people know a close family member with diabetes? All right. And now, how many people know a close family member with mental health problems? Yeah, you can see the number is very little compared to the physical health problems. Mental health problems are quite similar to physical health problems. The main difference really is the problem is in the mind, okay, the brain and the mind. But we know there's a lot of stigma around it. So this is what we want to do today, to dispel the stigma and demystify, dispel the stigma, so we'll be in a better position to support and help people who have mental health problems. One of the reasons why this is important, as we see also in our religion, in terms of the objectives of the Sharia, one of the fundamental objectives of the Sharia is to protect the aql, so to protect the intellect. Allah says in many places in the Quran, Afala ta'akilun, so it's a rhetorical question meant for us to think about what Allah subhanahu wa ta'ala is telling us there. Afala ta'akilun, don't you reason? I know we've all had our dinner and we will be very tired, so to keep us alert, I'll be asking you questions. So the first question will be, when we come back for the discussion, so I want us to give us the answer then. So who can tell us the first and the last verses where Allah subhanahu wa ta'ala mentioned aql? So the first and the last verses in the Quran where Allah subhanahu wa ta'ala mentioned aql. So Allah says, afala ta'qilun, which you reason. One of the reasons why aql is so important is that aql, or the lack of it, is responsible for our behaviors. So, and we know that this is what Allah subhanahu wa ta'ala is going to ask about our deeds. So, on the day of judgment. So, it's important that we address this. So, in terms of talking about mental disorders, we know it's quite common. For instance, the World Health Organization says 1 in 8 people have mental disorders. So if we are about 100 in this room, there will be about 12 people who have mental disorders. And one of the other things why we need to be careful, I know the youngsters are not here. Studies have shown that 50% of mental disorders emerge before the age of 15, and 75% emerge before the age of 25. So that age group is very crucial. So hopefully we'll be able to pass on this message on to the youngsters, and we will see why. So today, inshallah, we will be talking about the risk factors to watch out for, so that we can prevent mental health problems developing. And for those who do have it, what we can do to reduce the impact and the burden. This is one of the prayers of Prophet Muhammad sallallahu alaihi wasallam for well-being, and we would seek refuge in Allah we would ask Allah to reveal His weaknesses. So if we're able to identify what those vulnerabilities are in terms of our aql and mental health, then we'll be in a better position to look after ourselves. One of the reasons why we are also discussing prevention today, more recently there was a study, because in the UK, I think it was concluded last month. They surveyed about 13,000 young people, and about 44% of them said they had to wait longer than a month before they got help, and 58% said they got worse while waiting for help. So you can see there isn't enough support out there. You have to wait. And there's an increase in referrals, and you have to wait to get the support. So it's really important to know what to do prevent it, and if we have it, to manage ourselves before the help comes. So today, inshallah, some of the learning objectives will be increasing our awareness of the body of mental disorders, 2, understanding the risk factors. We will, inshallah, talk about stress, because this is one of the important risk factors. Then, how do we appreciate the Quran and the Sunnah as valuable resources for healing and recovery? And hopefully at the end of this talk, we'll be able to appreciate why those who follow the guidance of the Quran and Sunnah should have better health outcomes than those who don't. So these are verses for us to really reflect upon, talking about Quran as a healing. So 2 questions for us to, I would really like your views on this. So how does the Quran heal? And who does the Quran heal? So I'll be looking forward to your response during this question time. So to understand mental illness and mental disorders, we need to appreciate what health and mental health is. The World Health Organization defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. They define mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and they are able to make a contribution to their community. So, mental disorder or mental illness will be a disturbance in mental health, often associated with dysfunction in relationships, in family, in work, in education. And I also want us to note in this definition, the level of stress is normal in life. Those who do not appreciate this, they will have problems in their recovery when they become unwell. Like Allah says in Surah Al-Falaq, so we have created mankind into hardship. It's important to realize this. So I will give 2 case scenarios so that we have a basic a feel for what mental illness is like. So the first case is that of a woman with the first case is that of a woman with depression. She's had multiple episodes of depression. So the current episode started about a year ago after the death of her mother. And she tried different medications, antidepressants, which didn't work. So it has impacted on her work. So she had to have sick leave. Then she began to feel guilty. She began to feel guilty that she's letting her colleagues and family down. So guilt feelings is one of the symptoms of depression. So then she approached a psychiatrist with feelings of hopelessness and worthlessness. These are red flags. So when you see hopelessness and worthlessness, these are risk factors for suicide. And so, of course, she has been stockpiling on pills. Then the issue is that she's taking overdoses and self-harm when she was younger. So people who have had history of suicide attempts or self-harm, that's another risk factor for suicide. So when we see this in people, hear this in people, this is the time to really get help as soon as possible. So self-harm started at 14 when her parents separated. Shortly after, she disclosed bullying in school, physical abuse by her father who misused alcohol and illicit drugs. So again, these are risk factors for developing mental disorders, particularly bullying. We need to act on these things when we hear about them. And of course, the father who didn't look after himself, now transferring the problem to the daughter. So the next case is that of a man with schizophrenia. Schizophrenia is a mental disorder, a severe mental disorder, where people psychotic symptoms. Generally, psychosis can be described as losing touch with reality. So, in schizophrenia, we have what's called positive psychotic symptoms and negative psychotic symptoms. Positive psychotic symptoms are things like hallucinations. For instance, people hearing voices or seeing things where there's no one around to explain this. Then the person will be seeing things that we can't understand. We can't understand their speech. That's called thought disorder. And the third thing is what we call delusions. So people having false beliefs. For instance, they say, well, they have millions of pounds, but they actually do not. Or that people are trying to kill them, which is not true. And the negative symptoms are things like social withdrawal. They just keep to themselves. So they have apathy. This blank face, they can't enjoy anything, they're not interested in doing anything, and they are unable to look after themselves. So this man has had schizophrenia for 15 years, he's been hospitalized many times and even detained against his wish. So he believes that he's under constant surveillance by the government organization, and he's followed wherever he goes. So he sees people who he believes are agents on the streets. So these are the positive symptoms. And when younger, he assaulted his father and brother, believing that they had been replaced by agents and they're spying on him. So these are delusions. So you can imagine the impact this would have had on the relationship with the members of his family. He spends most of his time alone in his flat. He takes no interest in his appearance or hygiene. His flat is untidy, and he holds a considerable amount of unpaid rent. So these are the negative symptoms I talked about. He has not worked for many years. So in terms of his history, he was sexually assaulted by a neighbor at the age of 12 when he started taking cannabis and other illicit drugs. Then his uncle suffered from schizophrenia. So these are the risk factors which we will talk about more in details. He has received many treatments which did not really help. So he feels powerless and hopeless. So this is a typical example of patients we see in rehabilitation psychiatry. So this is what we would like to prevent. But for those who have it, or who have family members who suffer this, there are things that can be done to relieve the body. So inshallah we will be talking about this today. So here's a list of mental disorders. We're not going to go into them, just for you to appreciate that there are so many of them, and this is not an exhaustive list. So I want to point out the red line there, the group substance misuse and impulse control disorders. So we are seeing a lot of young people presenting with this today. So alhamdulillah, we'll talk about the social media this morning. So this is a real problem. I'm not going to go into details of what was discussed. I'm sure many of us benefited immensely from that talk. But I'm just going to say this is real. For instance, gaming disorder, compulsive sexual behavior disorder, the pornography and other things that people do on the internet. So of course some people are saying they have social media addiction. So in situations where people cannot control how much time they're spending, or when they have to use it, they can't stop themselves, okay? And they have to prioritize what they're doing, maybe the social media. They prioritize that over things that are important, family, work, education. And they continue to do it despite harmful consequences that they are addicted. So it's important to appreciate that these problems exist actually. So the important take-home message is that we shouldn't wait till things get worse. So I do know people who have had therapies for gaming disorder, gaming problem. They just keep playing games, even though they don't want to. It's gotten to a stage that they are not able to sleep. They just have to keep playing the games. And they are addicted to it, and they've had therapy, and it doesn't just go away like that. I don't know if any of you has played Warcraft. Maybe the youngsters are out here. Animal Crossing. So one of the advice was that, well, you should substitute something that's less addictive, which is Animal Crossing, for the one that is more addictive. Which is that in substance misuse addiction, for instance. Somebody substituting methadone for heroin. So, but the problem, the article message is, don't let it get to that stage where you are addicted. So, again, WHO says 1 billion people out of 7.5 billion has a mental disorder. So you can see how numerous this is. So 264 million people suffer from depression. So the burden of mental disorder is just not about the statistics. So, for instance, somebody hearing voices, they're not able to concentrate. Many of them have to stop school, they have to drop out, and they are not able to work. People who are anxious, they are not able to take their children to school, for instance. They are not able to, some are not able to open letters because that causes a lot of anxiety in them. And there are people who eat from dump sites, for instance. We see a lot of this in developing countries. And some of them are not able to do everyday tasks, like cooking, looking after themselves and tidying up and all that. And on top of that, there's the social disadvantage, like stigma and discrimination, the loneliness. Many of them have unfulfilled sexual needs because they're like you and I, really. So it's important to know how we can address this and support them. So another of Prophet Muhammad sallallahu alaihi wasallam's prayer for well-being, really, we will ask Allah to grant him health. So, but who can tell us, because in this prayer, after asking for health, or physical health, Prophet would seek refuge in Allah from disbelief and poverty. Who can tell us the connection between physical health, disbelief, and poverty? Brothers and sisters.
I think anyone who is physically challenged or who is having health issues will seek help wherever, whatever such a person is said to, his advice will be. They will aspire to do it in order to gain health. And to some extent, can also go to another end by, getting involved in kufr, disbelief. And health issues definitely requires a lot of spending, which could also lead one to poverty. They are all connected, one way or the other.
It's important to know that disbelief really is one of the diseases of the soul. And Prophet Muhammad sallallahu alaihi wasallam would ask Allah for his physical health, then would ask Allah to save him from disbelief, which is the disease of the soul. We as Muslims in Islam, we believe in the soul, the body, the mind, and the soul. But the Western scientific paradigm, they don't believe in the soul, so we are different from them. And poverty is a determinant of illness, physical and mental illness, really. So we will talk about that in the future. So here is a diagram of the Islamic model of the soul, according to Quran and Sunnah by Abdullah Rothman. So it shows, it depicts the body, the mind, and the soul. Just like the body has the heart, the soul also has its heart. And Allah subhanahu wa ta'ala says, those who will succeed are those who come back to Him with qalb salim. So that sound, healthy heart. And so we are required to make sure that we transform our souls from the evil commanding self or soul, not to Amara Basuri, to the tranquil soul, that is not soul but mahina. So this is really important. So I'm sure we know a lot about this, but it's just to draw attention to it. So the second part of our talk will be about causation and risk factors. Generally, for mental disorders, we talk more about risk factors than causes, because most of the disorders, mental illnesses, they are caused by a complex combination of genetic factors and environmental stressors. So that's what's known as the stress vulnerability model. The relational model looks more at the bigger picture, okay, the relationship between these factors and through our life journey. So I would have showed you a YouTube video on this, but perhaps we wouldn't be able to because of the internet connection yet. But I will make the slides available to the organizer so you can access this in your own time. So we do have a small proportion of cases where there are known factors. There are known specific causes. For instance, in Down syndrome, which causes learning disability, temporal epilepsy that causes psychosis, and autoimmune encephalitis. This is a condition where the body produces antibodies that attack the brain and leads to a schizophrenia-like condition. It can be really terrible, and may Allah protect us from that. And of course, we know about drugs and causing problems. So the diagram there depicts the brain cell. So with the cell body and the tail called the axon. So information passes along the axon, along the tail, by electrical impulses. The brain cells do not actually meet. Okay? At the end of the tail, there is a gap between them called the synapse. So, and information crosses this gap by chemical messengers called neurotransmitters. Okay? So, and we know the function of certain neurotransmitters. For instance, serotonin, which is involved in happiness and confidence, acetylcholine for memory, and we have the GABA, which is important in resilience and anti-anxiety, and we have dopamine, which is involved in pleasure and reward. So, at times when there's chemical imbalance between these neurotransmitters, they can lead to mental disorders. In fact, most of our medications which we give, they attempt to correct this chemical imbalance. So again, this table shows the risk factors, but in a tabular form, in terms of predisposing, precipitating, and perpetuating factors. I'll just point out one of them, like race. For instance, we know that migration increases people's risk of schizophrenia. And it's been shown that people who migrate from a black majority environment or country to a black minority environment, they have an increased risk of having schizophrenia. And this risk occurs in the second generation, those who are born here as well. So we need to take this into consideration and pass this on to our children or offspring, because when you combine that risk factor and there's financial difficulties, which is another stressor, and there's marital or family problem, which we just discussed, and then another friend says, well, take this alcohol, take this drug to help you calm down. I've been taking this for some time, you forget all your problems. You can see the added risk the accumulated risk, which increases the risk of developing illness, becoming exponential. So it's important to know this. The other thing is that people don't have the same risk profile. So somebody might be taking cannabis and other drugs, nothing happens to them, but if you do take it because you have a different risk profile, you may come down with the illness. So another thing to be aware of is the protective factors. People have, of course, apart from the risk factors, there are the protective factors as well. So two people can be exposed to the same risk factors, but one of them will develop the disease, the other will not, because of their protective factor. So, for instance, it's been shown if we have low self-esteem, we need to try to correct this and build our self-esteem and confidence. If we have medical health problems, but this is another risk factor, we need to try and get the medical, physical health problems resolved as quickly as we can. Then if you have work stress, try and get it, try and address that problem or get another job where you have job satisfaction to protect yourself. So, and we find that, in fact, all the objectives of the Sharia, really, and the activities that the objectives of the Sharia promote, they are things that protect us from mental disorders. So you can see all the risk factors which I have mentioned, really. So there's been a lot of research showing that people who are religious and spiritual, they do better even when they become unwell. Well, religion and religiosity and spirituality protects you from becoming unwell, and when you become unwell, you have better outcomes in terms of recovery. So lots of research on this. And again, we've talked about marital difficulties and all that. And even at that, the rules and guidance of the Quran in terms of relationships actually protects us from coming down with the illness. So I know this can be a controversial topic, but we live in an environment, in a paradigm which doesn't subscribe to belief generally, and they do not believe what we believe. So the Western scientific paradigm, they don't believe in possession. They say that people who say they are possessed and they are diagnosed with possession and trance disorder, for instance, that they say that because of the culture they come from, that they come from a culture that accepts possession. And they explain that, well, it is similar to people who hear voices, that the voices are actually coming from their brain, but it's just that they cannot recognize that it's coming from their brain. But we know in Islam, there's evidence in Quran and Hadith that there are beings called jinn, which Allah subhanahu wa ta'ala created, and they can influence.
Please, somebody should help us take care of the children at the back, so that they minimize the noise, please, and the adults as well. Please, let's listen. We enjoy it more if we listen, please.
They can influence people's thoughts and behaviors, and if they're extreme, they can, when they take over people's actions and conduct, so they are labeled as majnoon or mad or possessed. There's also evidence in the Quran and Sunnah that the envious soul can also influence another soul. So that's the evil eye. So if you go to the tafsir of Surah Al-Qalam, verse 51, you can see a lot there in Ibn Kathir. So Prophet Muhammad sallallahu alaihi wasallam taught his companions with prayer. May Allah protect us from this. So the third part of our talk, according to the World Health Organization, there are 3 levels of prevention: primary, secondary and tertiary levels of prevention. Primary prevention has to do with, it is focused on people who don't have the illness or disorder at all. So it's about trying to prevent people getting the illness. So it's about health promotion. So for instance, things like stopping smoking, for instance, alcohol, no alcohol, no drugs, then being physically fit, doing exercise. Then targeted familial vulnerability. If you know you have a mental health problem in your family, it's important to pass this information on to your offspring so that they can protect themselves. They need to work extra hard and protect themselves compared to those who don't have that family history. It's important. Then you have to deal with other non-genetic risk as well. And things like talking about them, like we're doing today, I'm sure they do that in schools as well. And to try to address problems created by climate change and other social determinants of mental health problems, so which we'll talk about. The secondary prevention, that's about early diagnosis and treatment, identifying those who have problems early on before it gets worse. We do know that if mental disorders are treated early, the outcomes in terms of recovery, they are better compared to when they go on and untreated. And for instance, when we're talking about psychosis or schizophrenia, 4 out of 5 people will go on to have further episodes. So that's the nature of the illness. And depression as well can be recurrent. So when people have it once, many people will go on to have further episodes. So it's important to treat it as soon as possible. And tertiary prevention occurs in people who have chronic illness, and what we can do is to reduce the burden and the impact on them. So in terms of primary prevention, so that starts really hard before birth and postpartum as well. So good antenatal care, the nutrition of the pregnant woman is really important. So that's why they suggest folic acid and all that because of the effect on the brain. Yeah. Then we do know that what the woman eats helps to nourish the babies. So for instance, small babies, premature babies, they are risk factors for developing mental illness later on in life. And smoking in pregnancy, for instance, has been associated with ADHD. So I'm sure we all know about this. And people who smoke, take alcohol or illicit drugs in pregnancy. So these are also risk factors for the child developing mental illness later on in life. The importance of social support and family network in pregnancy cannot be overemphasized. I'll talk more about this in the next slide. So then the early years of the child, they are quite critical in terms of what happens later on. So it's something called attachment, and that's the special bond or bonding between the child and the parents or anybody that looks after the child in that early year, really. So probably the grandma, for instance, if not the parents. So it can either be good or bad, the attachment. The good attachment, that's what we call secure attachment. So that's the parent being sensitive and responsive to the needs of the child. But the bad one is the insecure attachment. So maybe there's neglect, or the parents are insensitive, or they are not consistent in looking after the needs of the child. Or sometimes they can be over-involved with the child as well. So secure attachment protects the child. It's a protective factor from the child developing mental illness later on in life, whilst insecure attachment can lead to problems later on in life. So in terms of the Islamic guidance, Allah subhanahu wa ta'ala has, for instance, in Surah Al-Baqarah, told us about breastfeeding in terms of nurturing the children. And Quran actually recommends that for those who want to complete it, how many months? With the 2 years, mashallah. So there's a study which I've quoted there, published in 2022, really, showing that from their study, children who were breastfed for 12 months or more, they had better cognitive level in terms of their test between the ages of 4 and 15. So better ACO than children who were not breastfed up to that amount. So we see that the words of Allah is always true. So in terms of social support as well to the woman, this is really very important, particularly in this period, pregnancy and early years of development of the child. So what the care that we give to the pregnant woman or the woman looking after the child also determines to a great extent what happens to the child later on in the future. For instance, we know women who complain of inadequate social support or in true marital discord or domestic violence, domestic abuse, or there's some negative events like bereavement or financial problems, they lost their job recently, they are more likely to develop postpartum depression. And the other risk factors for postpartum depression include people who have had previous history of depression, or women who have had depression during their pregnancy, or family history of depression. So there's been a study as well, a recent study, that showed that children from women who have had depression, maybe postpartum depression, they are more likely to have psychosis later on in their adolescence. So we can see the impact of, if you look after the mother while they're looking after the children, or while they are pregnant. So these are protective factors for developing, for the child developing mental problems later on in life. And we keep seeing this time and time again in clinic, women complaining that they don't have enough support from their husbands. Because women will have to look after the children, then they do the house chores as well. So we are not talking about Muslims alone, but because we are Muslims there, we have to focus on ourselves. So women keep complaining about they don't have enough support from their husband. So I think it's important that we address this. And I think I don't know if I'm allowed to say this. This is one of the things that we addressed the previous session. So alhamdulillah for that. Don't get me wrong, I'm not saying I'm perfect. I do get what I call constructive criticism sometimes, that I could be more helpful as well. So, but the verse in Surah Al-Nisa, verse 34, which is very, I'm sure, very familiar to us, where Allah says, Al-Rijalu Qawwamuna 'ala an-Nisa. I think Imam al-Qurtubi, rahimahullah, says that word Qawwamun means that men provide for women and they also defend them. So we need to be defending women against mental problems. So, and that's by making sure they have adequate support. And again, the hadith of Prophet Muhammad sallallahu alaihi wasallam saying, every one of you, each one of you is a shepherd, and you will be held responsible for your flock. May Allah help us to accomplish this task. How many moments do we have? 3 minutes or 3 minutes? Okay, inshallah, we'll talk about this stress. Then we end there, then we come back to...
Make a quick summary of that, then question and answer.
inshallah. So, stress is any stimulus, really. It could be internal or external. Internal stimulus will be you thinking about, oh, I've got to pay the school fees, pay the rent, my car, fix my car, and I don't have enough to do all this by tomorrow, and you're losing sleep because of this. So external stressors will be maybe your boss or somebody on the street shouting at you, or Allah forbid, a couple shouting at each other. So stress can actually have positive effects and negative effects. We know about the negative effect already, but it can actually have positive effect. Because when people are put under some pressure and they are facing challenges, they perform better. And that's what this graph is showing. Up to a point, performance increases with stress. But at a certain point, then it begins to drop again. So we can see that stress can be helpful. But then in the long run, if it's prolonged, if it's excessive, it actually damages the brain cells, can lead to death as well. So, you know, the stress hormones, cortisol and adrenaline, and what they do really to get us ready for that fight or flight response. And it's important to be aware of the signs of stress, like anxiety, anger, depression, low self-esteem, feeling helpless, becoming tearful, irritable, or not being able to make a decision on time. So it's important to be aware of the symptoms. So for ourselves, so we're able to get help, and if it's happening to other people, we're able to recognize, we know when not to make matters worse. For instance, we know when not to say, oh, there isn't enough salt in this food, or when are you going to buy the jewelry you promised me during our nikah? So it's important to know when not to aggravate matters really, because it can go on to aggression and then other problems as well, affecting the relationship seriously. So I'm going to conclude here. In terms of managing stress, the first thing is awareness, which I've talked about. The next thing is exercise, really. For instance, walking, then taking time out, just taking a step back from what's stressing you. Then grounding techniques. Grounding techniques are things that we can do to divert our attention away from our worries. Okay? For instance, there's focusing on the present moment. For instance, there's the chart shows the 5, 4, 3, 2, 1 grounding technique. So it says you should think about 5 things that you can see, then 4 things that you can feel, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. So by the time you go through all that, because we are focusing your mind away, you're diverting attention from your worry, you're focusing on what's on the present moment. So you're going to reduce your stress, inshallah. So I want you to compare this with wudu and salah. For instance, you open the tap, you can see and you can hear the water running. Okay, when you wash your hands, we're starting with basmala, you can feel the coolness or the warmth, depending on the type of water you use. Then you wash your mouth, you're tasting, you're feeling, then you're sniffing water, you can smell it, and all the senses are involved, really. So then splashing water on your face alone, that's a grounding technique. It's a known grounding technique. When you splash water on your face, it can help you distress. So we can appreciate what Allah has done for us to distress really 5 times a day if we do it properly. Then by the time we go on to Salah and we have Wushu, then we can see how we can address our problems. And may Almighty Allah help us attaining Wushu. This is something that we have to constantly work on. So I think there's a book I think has really helped. Many of us might know this 33 ways of attaining, of developing sugar, shape, solid object. So other things that we can do is talk to someone, then plan relaxing activities, which the organizers today have helped us to achieve. The Almighty Allah help us protect our akal, and help us protect our belief as well. And the Almighty Allah forgive me all the shortcomings, they are mine, and the good that come out of this is only Allah's. The Almighty Allah make us understand it better than I've been able to present it. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك سبحان ربك رب العزة عما يصفون السلام على المرسلين والحمد لله رب العالمين.
كبر الله تكبير.